Hi, everyone. Thank you so much for joining me again. My name is Nikki, and I'm a health equity education coach. And I help academic nurse leaders to bypass the trial and error of common mistakes in teaching equity, diversity, and inclusion so that students are prepared for the rigor of practice. And it is the season of the nurse. Happy Nurses Week to all of you. I'm incredibly honored to be a nurse. I've worked hard for it. I've made a lot of sacrifices for it, and I can truly say that due to my training and commitment, I'm excellent at it. So I wonder if the same can really be said of the nursing profession currently. And this month of May, I'm continuing this journey to talk about nursing students. And I want to talk to you today about our nursing students being overlooked and just sort of being passed along because of our own moral distress. And I know I'm talking about a sticky subject, but who better to approach it than a health equity education coach, right? So, as a clinical instructor teaching currently, from where I'm standing, it really does seem that nursing students are not adequately prepared for the rigor of the work that they will be walking into. And I get nursing students at almost the very end of their training, their very last semester before their practicum. And so by the time they reach me, they should pretty much have a skill set that they can demonstrate. And I can tell you that recently I was involved in leading a blood pressure clinic, and I had one student who was really nervous about it and was panicking a little bit about it. Pulled this student aside, tried to calm the anxieties that were happening, did some breathing exercises, which I think is really important, and also taking a moment to step back and just gather yourself. The expectation was to return and to demonstrate the skill of not only demonstrating the blood pressure, but also engaging with the community, talking to the clients about their needs, etc. And I honestly wanted to see some clear communication, some strong communication, building rapport, history gathering, and the like. And what I can say is, I was really concerned by the student's inability to perform the task that was asked or the competency that was asked. And so, talked a little bit later to try to get a better understanding. And there were some other extenuating circumstances. However, none of those circumstances seemed to negate being able to perform and demonstrate the blood pressure and working with the community. So, what I honestly believe is that even though this was an isolated incident, I don't think it's an isolated experience. I really think that I can pull together 10 other clinical instructors and they would say, yeah, we have students that are having a really hard time at the end demonstrating competencies that we would expect for them to be able to do. And what really took my breath away is that when I asked the student how they would cope with some of their challenges that they knew that they had, there was no plan in place to be able to deal with it. And that really concerned me, especially as a health equity education person, is that there was no real plan in place to deal with what could come in the future, the rigor of nursing practice. And having been a clinical instructor for years, I've watched as these standards have slowly changed. They have definitely changed since the time that I practiced in nursing school. And in most cases, it doesn't feel like it's for the better. So tell me, as instructors, as faculty, as academic nurses, what concerns do you have about nursing students being able to cross over into full nurses or into those novice nurses? I would love to hear your thoughts. If you aren't following me yet on YouTube, follow me on YouTube at Transform Nursing to find out what to do if you're needing more support around having students be able to demonstrate competency. And please sign up for my on demand webinar to the ANA, where I'll be presenting on overcoming obstacles to a successful DEI program, key actions all nurse leaders can take now. The link will be available on May 17th. Thanks so much, and I hope you take these things into consideration.